We would not purposely add arsenic to the water supply. We would not purposely add lead, but we do add fluoride. And the fact is that fluoride is more toxic than lead and just slightly less toxic than arsenic. This is a quote from Dr. Yamahanis in regard to the fluoridating of the U.S. water supply. Most communities in the United States have fluoride added to the community water. However, the health benefits are in debate, and there is potential individual health side effects. I work in community healthcare and have done extensive research on fluoridation, and I have found that the following points are important to consider when looking at the fluoridation of United States water supply. What is the history of fluoridation in the United States? We need to evaluate the health benefits and also look at the potential side effects of fluoridation. So what is fluoride? It exists in lower amounts naturally in the ground. However, it seeps into the water supply usually from being a byproduct of manufacturing. Gary Knoll wrote a paper called Fluoridation, Medicating Our Water. He noted, fluoride is a stable mineral, usually formed as a byproduct of chemical manufacturing. It's a toxic waste product of aluminum, phosphate, cement, and nuclear weapons production. It was first discovered by William McKay in Colorado Springs, Colorado, in the early 20th century. He did research after finding that 90% of the population had dental damage. After finding it in Colorado, it was also found extensively through the Rocky Mountains, in Texas, Italy, and even Portugal. In the 1930s, another scientist stepped forward to study fluoride. His name was H. Treadley Dean. He was looking for ways to filter out the fluoride from the water and accidentally found that it strengthened the enamel in lower levels. He oversaw the first clinical trial of an entire city being fluoridated through the water supply in Grand Rapids, Michigan in 1953. Another scientist to step forward at the time, his name was Gerald Cox. He was associated with a research lab funded by Alcoa Manufacturing. Alcoa was responsible for aluminum manufacturing in the area, and major byproduct was fluoride that they were leaking into the groundwater. Alcoa promoted studies to examine the fluoridation of water supply and then offered to sell communities the fluoridation to add. So what are the health benefit claims of fluoride? Well, in proper amount, it strengthens the enamel. This is done through direct contact to the tooth. But it's also stated that by adding it to water, it's absorbed through the body and helps the teeth. Some studies claim that there is a reduction of dental decay up to 40 to 60% in communities that were treated with fluoridation in their water supply. What are the potential negative health effects of fluoridation? We need to remember there's much more direct ways to fluoridate and help the enamel of a tooth. Dentists recommend adding it to toothpaste, mouthwash, and sealants, none of which are swallowed or ingested. A 1999 Italian study showed that social status, location, and sugar consumption were a much larger prediction of dental decay than fluoride consumption in the community. The authors conclude that universal fluoridation through the water supply is insufficient. An issue arises because fluoride cannot be regulated for individual consumption when it's just added to the water, we really don't know how much a person gets. This increases the risk for side effects. One side effect is called fluoridosis, which is actually what Dr. McKay saw in Colorado Springs, Colorado. This example here shows a mild form of fluoridosis. We see the white spots on the teeth underneath the enamel. A more severe form is this picture, which is a severe form of fluoridosis where there is a molting of the actual tooth underneath the enamel. It also increases the risk for weakening bones, which causes osteoporosis, neurological damage, and also increased joint pain through arthritis. Another issue arises because the studies that were done on fluoridation were not able to be randomized or controlled. This brings into question the results of the studies themselves. But despite those questionable results, Human Health and Services states that fluoridation remains an effective public health strategy with a low cost. However, a 2001 article written by the Journal of American Dental Association admits fluoride swallowed and incorporated into the teeth is insufficient to have a measurable effect. This was brought out by Catherine Carstairs in her article, Water Fluoridation by Dr. Strangelove. So the benefits of fluoridation was accidentally found when studying teeth damage in a community that had the waste product in their water supply. It was promoted by companies that were producing that waste product. The mixed results studies and the lack of controlled parameters brings into question the results of those studies. The small positive benefits that are made by ingesting fluoride do not outweigh the potential health side effects of fluoridating the U.S. water supply.